Okay, good evening everybody and welcome to our YouTube event. We have had a few technical glitches, so we haven't been able to stream this live, unfortunately, but we will be back with more live events in the future once we can get the technology working, so apologies for that. It's International Nurses Day today, which is brilliant, and it's such a great opportunity to celebrate the amazing profession with all the different routes in and the different opportunities that there are within nursing. And I'm joined this evening by a really brilliant panel, which is great. We've got some student nurses and some registered nurses, and I'm going to be talking to them very, very soon. My name is Abby and I'm the Careers Information Lead from the NHS Health Careers team, and we'll be with you probably for about 45 minutes, I think, and we've got lots of really good questions for our panel. So we hope that we'll be able to inspire you. You might be thinking about doing nursing, you might already have decided that you're going to be doing nursing, or you might already be training or a registered nurse and just wanting to find out, you know, little bit more information, get some inspiration, and hopefully we'll be able to give you some good signposts as well, so that you can go on and find out more information. So first of all, what we're going to do is some introductions. So I'm just going to ask each of you to introduce yourselves, please, and then we will get chatting with some of the questions. So Fiona, could you go first, please?
Yeah, hi everybody, I'm Fiona Springle and I'm a learning disability nurse. I'm currently working as a children and young persons learning disability and autism specialist nurse in an acute NHS hospital in Norfolk.
Lovely, thank you, Fiona. And Emily?
Hi, I'm Emily Gateshouse. I'm a student nurse. I'm studying adult nursing in my second year at the University of West of England.
Lovely, thank you very much. And Abdul?
Hello everyone, I'm Abdul, second year mental health nursing student at Middlesex University.
Fabulous, thank you. And Ty?
Yes, hello everyone, my name's Ty Mitchell. I'm an advanced nurse practitioner. I'm a mental health nurse by background. I'm also a qualified and accredited CBT therapist and a non-medical prescriber. I currently work in a CAMS setting and I'm also an associate lecturer at Northumbria University.
Busy man, thank you, Ty. And Ross?
Hello there, I'm Ross Slade and I'm also a second year student at the University of West of England and I'm studying adult nursing.
Lovely, thank you very much. So it's really brilliant that we've got a mixture here of people from different fields of nursing as well, because we wanted to make sure that we could, you know, give you as much information about the different fields of nursing as possible and have people at different stages of training or experience too. Okay, so let's get stuck in then with some of the questions. And Emily, we're going to come to you first. What first attracted you to nursing?
I guess it's the opportunity to work with different people and just work with the public and just meeting such a variety of different people from different backgrounds. I have a previous job background in the theatre world and in the arts, and that was really great to engage with people, but I just wasn't getting that rewarding feeling come back. So that's also another reason why, you know, to be able to care and help support people in some of the darkest times. And also just I find it really interesting. It's quite challenging. There's always something new to learn. The sort of expert knowledge that you get from studying nursing was the sort of three main reasons that I was drawn to changing my career.
Brilliant, thank you. I think that fulfillment that you talked about is quite key for a lot of people, isn't it?
Yeah, absolutely.
Great, thank you. And Fiona, same question to you really. What kind of brought you into nursing?
Yeah, so similar to Emily, I previously have a background within the arts as well. So I initially commenced a music degree post A-levels, and sort of over that year of doing or starting that degree, I was like, actually, I want more. So I had previously been working as a support worker anyway with people with learning disabilities. And I also have a big brother who is autistic, who also has a learning disability as well. So I've always had that passion for ensuring that that cohort of people get the right support. So I think, yeah, it was just about being able to support such a marginalised group of society. And what's the best way to do that? Well, via learning disability nursing. So yeah, that's certainly what attracted me to moving over to nursing instead of music.
Brilliant, thank you. And just to come on then to kind of how you can get into nursing, and Abdul, if I could ask you, what were the entry requirements that you needed to get onto your nursing degree course that you're doing now?
So I believe there are two options. You can go straight from school, but that wasn't the case for me. I did something called the Access Course to Nursing, which is 1 year. So they basically teach you about nursing in general, and you have to do the level 2 English and maths as well, which is 1 year. I mean, for me personally, I took this path because I've decided to join nursing later on in life, as opposed to when I was younger.
Yeah, brilliant. So that access course gave you the equivalent of A levels or other level 3 qualifications, basically.
Absolutely, yeah.
Brilliant. Okay, and I think that message is really important, that it doesn't, you know, it's not just about A levels and then straight into nursing. There, you know, all of you have had slightly different kind of routes in, and so it's, yeah, it's great for people to know that there are so many different options. Great. Now, Ross, I've got a question for you, again related to kind of the start of the process, really. So did you have to have an interview when you applied for your nursing degree?
Yes, I did. I had, and actually it was at the time of COVID, so normally it would have been face to face, but for me it was not actually the same as this Microsoft Teams, and it was an online interview. And it was, there was a few different questions, I think, like asking you about things like your motivations for joining, and also things about really, I think, about like the 6 C's for nursing, and things like compassion. And they asked things about that. But yeah, that was basically the interview.
Brilliant, thank you. Did the kind of values, did the discussion around NHS values come into the interview as well at any stage?
Yes, yeah, I think there was. I think it was just basically asking you what you felt of were the values that matched with the NHS, and how you felt. And I think that was something they asked. Yeah.
Brilliant, because it's so important, isn't it? They're not just looking for those academic qualifications that you need, but also the, you know, what do your values, as you say, do your values match those of the NHS? Because that's, so it's absolutely vital for the role, isn't it? Great. Ty, you mentioned that as well as being a mental health nurse, you've also had the opportunity to do quite a lot of additional training by the sounds of it. Does that kind of feel like it for you, or if you wanted to, are there other kind of progression opportunities ahead?
Yeah, I mean, the NHS is absolutely fantastic for progression. You know, I like I said earlier, I work in a child and adolescent mental health service, which is CAMS, and there's plenty of opportunities within CAMS teams, as well as working with adults or older people services. So like I say, I've been fortunate to do my cognitive behavioural therapy with CBT training and non-medical prescribing. You know, I'm a bit biased towards those because they're my preferences, but there's ultimately, you know, loads of other therapies that you can be sort of supported through. You most of the time you'll receive your full-time salary as well, which is really good. In terms of job progression as well, there's absolutely ample. So I've not actually been qualified that long in the grand scheme of things. I've only been qualified just under 5 years. So I'm currently going into a CNS, which is a clinical nurse specialist role within a different trust. And I guess the following stage after that for me, if I wanted to, but not anytime soon, would be a nurse consultant post. So there's absolutely plenty of opportunities dependent on which stage you're at, and you can equally go into academia or other areas of nursing as well. But the NHS is the key place for me.
Brilliant. Oh, that's great to hear that you haven't stopped yet, and there's plenty more scope to progress. Fiona, have you got kind of future plans, or are you just going to wait to see what opportunities come up in terms of progressing your career? You're on mute at the minute, Fiona.
now? I'm so sorry, my
yeah.
computer is just crashing. I'm so
no.
sorry, everyone.
Oh,
It's
don't
gone all
worry.
glitchy. I hope you can hear me okay.
Yeah, we can. Don't worry, it
Fabulous.
happens.
Yeah, so yeah, no, absolutely. So I'm actually currently undertaking my advanced clinical practice masters as well at the moment. So I started that last year and I've got a year left on it. So looking at that, that's obviously a more generic masters, but I'm actually undertaking a bespoke set of modules at the moment related to learning disabilities and autism, which is fantastic. So I'm obviously hoping moving forward to that to go down the route of obviously an advanced clinical nurse practitioner, similar to what Ty's discussing, and with similar opportunities, you know, moving into nurse consultancy, etc. But I agree with Ty that obviously the NHS is the place to be.
Brilliant, thank you, Fiona. Okay, so just going to head back to the student nurses for a bit now. So Emily, obviously you've started your training kind of in the midst of a global pandemic, which nobody saw coming. Have there been any particular advantages as well as challenges to training during the pandemic?
Yes, I would say there are definitely positive. I mean, I know no different, but I think that's one thing. It's been incredible to see the resilience of the sort of trusts in different organisations, the creativity that comes out during these moments. I had placement on ICU and sort of, you know, trying new different practices based on the new research that was coming out and what they thought was best based on previous experience. Obviously, no one had full experience of what this would be like, and that just adaptability, you know, it's all these skill set that you talk about and you read about when you're training, and then just to see it in reality on this massive scale was a quite, you know, good positive. But obviously with adaptability comes a lot of changes and a lot of responding to, well, last time I was on placement we did it like this, and this is a different ward, and you know, obviously, you know, we're changing the way that we're dealing with COVID all the time, and then the vaccine got introduced, and there's so much that could have been quite overwhelming. And obviously the limited contact to people while studying, you know, doing a lot of things online, you know, changes the sort of dynamic of learning. But we're getting back onto the campus now, which is brilliant. We get to see one another, but then you learn something from being online, and just you build a different confidence, and you know, you can get on with the washing whilst you listen to a lecture. Like you can find different ways to make it work. And it also is more accessible for people with children, and things like that. So there's pros and cons to everything, isn't there? And it's just dealing with what is right in front of you.
Yeah, brilliant. And actually there are now some you've made a good point there, Emily, about flexibility, because there are now some nursing degrees that are called blended learning degrees, where you do the majority of the academic learning online. So there again, you know, just another way to kind of achieve your goals with more flexibility. Great, thank you. Abdul, coming back to you now, and just want to find out a little bit more about clinical placements. So kind of how long are they roughly, and what's the sort of split between your academic learning and the hands-on clinical placements?
So clinical placements is 50% placements, 50% more academic. So I mean, with everyone, there's different types of experiences that everyone has when it comes to placements. For me, the biggest issue that I had when I started placements was that I wasn't someone who's ever worked in a hospital. That's not experience that I've had prior to joining nursing, and that is the biggest challenge that I had to deal with. But I think most students who decide to go down this route have some sort of experience when it comes to placements, which helps. But then again, the advantage that we have is that we're really excited because we haven't seen this before, and it's like it's challenging, but it's for us it's like a way of finding our future career as well. So because I'm still undecided on what to do, if I'm honest. So exactly what route to take, but I will get there. I'll get there.
Oh yeah, you've got plenty of time yet, haven't you? Yeah. Brilliant, thank you. And have you had any particular challenges in terms of the academic side of the course, Abdul?
Well, for us, we started during COVID. It was all online. I mean, when we started, we was very excited. We thought we'd be in campus, and it turned out it was online, which was challenging for a lot of students. But then that in itself brought a lot of opportunities because, as Emily was saying, some students have children. You know, there was advantages for some students. There was disadvantages for other students who wanted to experience that campus life. So yeah.
Yeah, so pros and cons again.
Yeah,
I suppose. Yeah. Brilliant, thank you. Emily, we're back to you already. What support is there on your course if you are finding things tough?
So at the University of West England, we are split off into tutor groups, and so throughout our 3 years we have what they call an APT, an academic personal tutor, and there you'll go to for anything, any additional support. And they meet with us 3 times a year or something like that, but they're always accessible by email or meeting them at the university. You also have, when you're on placement, academic assessor. So if there's any issues with your placement, you can go to them or you can go to your personal tutor. When you're on placement, you're allocated a mentor, and it's usually 2. One is considered sort of the academic, sort of signing you off, so to speak, and one's a buddy. So there's either person you can speak to if you don't quite bond with one of them, that hopefully somebody else. UE also offers what they call academics in practice. So you have lecturers that are based for the different trusts. So again, if no one's, you know, able to help you, or you don't feel you can approach them, you've got another option. UE also has a practice support line, which was used massively during everybody going on placement and getting COVID and then having to come back, and they're brilliant with questions and concerns about placement. And then the other one I thought is your peers. I mean, I know we're online, but they're the people they're also going through it too. Other students that are on the placement, or if they're not doing the same placement as you, it's just nice to say like, oh, this happened the other day, like, yeah, that happened with me too, and you could just speak about more. And so yeah, there is the support out there, and there's multiple different avenues if one isn't quite appropriate for yourself. Yeah.
Brilliant, that sounds good. And staying with you, Emily, and still talking about support, but different kind of support. Could you tell us briefly about kind of the financial support that's available when you're studying nursing at university?
Yeah, so you have a student loan. I had done a degree before, so that's one of the things that prevented me from potentially doing nursing, as I didn't think I could get another loan. But you can for majority of healthcare degrees. I think it's paramedic sciences and one other, but I don't know if that's different now. But at the time, there's also the Learning Support Fund, which is a bursary that you don't have to pay back, about £5,000. I think there's also other little nuggets of money that can also come if you have children or a particular hardship. Going to and from placement, I also receive sort of travel and accommodation expenses, which is linked into the Learning Support Fund. And UE as well, the university, and I'm sure multiple universities have financial support. So there was a digital support scheme because everything was going online. UE set up this pool of money so people could buy laptops that were able for you to use. They have, again, another hardship support fund, and there's multiple different, you do. It's one of those things you have to go and find, but it is out there, and if you're sort of applicable to their criteria, it's a great thing to just go out there and see what extra help you can get.
Absolutely brilliant. Yeah, so the NHS Learning Support Fund is, you're right, so £5,000 a year if you're eligible. If you're studying mental health nursing or learning disability nursing, it's actually £6,000 a year. And then, yeah, as you say, there's the child support, or parental support bit, and the travel and accommodation, which is great. So yeah, all really helpful. And as you say, that bit doesn't have to be paid back, which is even better. Okay, Ross, if I could come to you now, please. So again, you're someone who didn't go straight from school into nursing. Did you find it easy to kind of fit in with the rest of the students, kind of with everyone being at different stages of life, really?
Actually, I think it was because of COVID and doing a lot of things online. we didn't really have, to begin with anyway, build the same kind of bonds with people. So I felt, and I think actually probably most of the people felt the same, because you kind of felt a little bit on your own, and it wasn't until I did my first placement that I had any contact, and that was with people who weren't in my tutor group. So it's just faces on a screen for the first 6 months. But then I think, yeah, like more and more, I've kind of now gone on campus a lot more. It has actually been, it's really nice because all different ages you kind of see. So for me, being one of the older students, then there's a lot of people of all different ages who you get a lot of different perspectives and that kind of engagement with all people, and it's a really nice environment. I think there's a lot of really kind of friendly people. It's that kind of, I think maybe it's that kind of profession as well.
Yeah. So have you got any sort of advice for people who do have that, you know, desire to switch careers a little bit later on in life?
Well, I think, like for me, I think it was because it felt like a big step, and I probably thought about it for quite a number of years, and I felt like there was, I think since my 20s, I had thought about nursing and switching. It probably was, I think for me, it was definitely financial. That was a big thing. And actually, because I think for me, because of the grant, as well as being able to take a student loan, I think that's kind of helped. It's you know, it's not easy, but it's kind of, at least it's helping a little bit more. So maybe, yeah, there is that, the financial side. But anyone who is thinking of it, I just think, like, you know, it is, if anything, worried about anything like the academic side or anything like that, there is support, and it's really good, because like for me, that was quite intimidating. I not studied for many years, and I think my first essay it felt like a bit of a challenge, but there was support there, and not just your tutor, not just the other lecturers, but there's also the other students as well, and you can discuss with people, even if it was online to begin with, but now face to face.
Yeah. Brilliant, thank you. And I can see all the rest of you nodding along with everything that Ross is saying as well. So it's obviously a shared experience, which is great. Fiona, if I could come to you now, are there any particular challenges that you come across in your work now, or in your study, either when you were training or in the study that the further study that you're doing now?
I think the biggest thing is the balance. So when I did my undergrad training, I was working 2 part-time jobs alongside that, as a support worker and a personal carer for a person with a learning disability. So I think my message is that it is doable, so you can absolutely maintain some form of work alongside your nurse training, and you've just got to kind of balance that out as best as you can. And likewise now, obviously I'm working full-time as a nurse, but I'm also doing study part-time at master's level, and that was certainly a really big learning curve, actually, moving up to that different kind of level of study, but also doing that alongside full-time work as well. And it's kind of working that out and slotting that in where you can. But yeah, it's a good challenge, it's a productive one, and yeah, it's going okay so far. I guess the other challenge, I don't like to call it a challenge, but it's just something that as a learning disability nurse, I guess we face. It's about trying to make sure that people recognise what our profession can bring and our speciality within nursing. So I don't like calling it a challenge, but it's something that we do have to do, you know, raising the recognition of our roles and what we can offer to the healthcare settings in general. But it is, again, a really, really important aspect of what we do.
Yeah, that kind of the educational side of it, almost for other healthcare staff as well.
Yeah, absolutely.
Yeah. Brilliant, thank you. Ty, could you kind of, I'm sure you work with lots of different people in your role and with the kind of different bits of your role, but who are the sort of the main other members of staff that you work alongside?
Yes, so we work in a multidisciplinary team, an MDT, and that comprises of loads of different professionals. So we have doctors or psychiatrists at different levels. We've got consultants or specialists and sometimes trainees, or foundation level trainees or higher level trainees. We have a psychology team who again consists of consultant psychologists, highly specialist psychologists, assistant psychologists. Then we have the nursing team. So there'll be me as the advanced nurse practitioner. We have a clinical nurse specialist and an associate nurse consultant. We also have some more junior nurses as CAMHS clinicians, and then we have sort of band 5s and band 6s, both CAMHS clinicians, which are different levels. We also have, it's quite a big team actually. We also have support workers as well, and we actually have some trainee, or we have a trainee nurse and associate, and then as most people, our placements will get, we get like student nurses or student nurses that are doing the apprenticeship program as well, and then we've got managers as well. But yeah, I mean, some teams as part of the clinicians roles, actually we can actually get professionals that are either like an occupational therapist or a social worker by trade. Not everyone from a nursing point of view is a mental health nurse to be employed into a CAMHS clinician post. So we have a real bright wide breadth of knowledge in the team, which is really good for development and making sure that children and young people in a CAMHS setting and other teams, it would be their speciality, but get the best care and have that really wide holistic approach.
Brilliant. Thanks, Ty. And Fiona, same question to you, please.
Yeah, it's a great question, and it's a very, very broad spectrum of different people. So within my specific role, I sit within our learning disability team here in the acute hospital. So we consist of 3 learning disability nurses, and we have a lead, an adult specialist, and a children and young person specialist, which is myself. Then within that, we sit within the complex health hub, which consists of more teams. So safeguarding, obviously ourselves as learning disabilities, dementia, substance misuse, mental health, and Mental Capacity Act. I hope I've not forgotten anybody. And then as part of that, we are in an acute hospital. So day to day, I can work with a whole variety of professionals, whether that be our staff on the wards, such as doctors and nurses, whether it be liaising with some of our admin teams. It could be liaising with our community practitioners as well, such as CAMHS, community children's nurses. I also work really closely with schools as well, and obviously, of course, with the children and their families. But yeah, there's a whole breadth of different professionals, almost anyone you could imagine related to healthcare I've probably worked with in some sort of capacity.
Yeah, so teamwork and communication massively important, isn't it? And understanding what other people do, you know, and what they bring and what experience they bring. Yeah, brilliant. Thank you. Ty, you mentioned apprenticeships just now, so if I could just kind of pick back up on that a bit, just so that we make sure we talk about some of the other routes into nursing, because I think you all either have come via or are going via a full-time university degree route, but there are now the registered nurse degree apprenticeships available. So Ty, are you you support some mental health nurses doing degree apprenticeships, is that right?
I'd like to hope so.
Yeah. And how does that work in terms of financial support for them?
So they because they're on apprenticeship, they get a full-time salary, so their course can be anywhere from like 3 years to 5 years, depending on what qualifications they've already got. Often, in fact, actually, both the people that are on a few people that are on the apprenticeship that I've met recently, they already work for our trust, so they'd already done quite a few qualifications. So they were on Agenda for Change pay bands, either I think 3 or 4, depending on where they were up to, or different scales within that. Yeah. So they get the full-time salary, and then their time split either in placements or uni days, but because they're on apprenticeship, they still have to do some work on their original place of employment, which is generally inpatient settings. So I think it varies on what year they're in, but both of the 2 lovely people that were in our team recently, they were sort of midway or towards the end. So at the moment when they're on placement, they're doing, I think it's about 22.5 hours a week in placement, and then they make up the rest on their normal paid job. And then when they're on the sort of uni weeks, they do 7.5 hours a week at uni, and the rest of their time's on full-time employment. But when I've been speaking to them, it sounds, you know, like a fantastic opportunity. You know, you get the core clinical skills on your your sort of placements, as well as actually picking up some of those skills within your original placement employment. And obviously you get paid for it, which is absolutely ideal, especially for people that might have already come for a job and sometimes might struggle financially to go back into that sort of being a student. So it's an absolutely amazing opportunity, I think.
Yeah. Brilliant, thank you. Yeah, you're right, and what's great is that we are seeing the number of opportunities to become a registered nurse degree apprenticeship really growing, and they're advertised on the NHS jobs website for those of you that might be interested in looking into those. And as Ty said, you're paid a salary and you end up with exactly the same qualification as if you've gone to university, and you end up, you know, if you complete it successfully, you end up as a registered nurse. So yeah, it's brilliant to have another route. Ty, you also mentioned trainee nursing associates just then. What else can you tell us about that role and how that kind of fits?
So again, I think that's quite similar. It's a shorter course. I think the trainee nursing associate, I think it's around 2 years. But again, you get a salary during that, and it's sort of I don't want to describe it because I'm not too fair on how it used to be, but I think before nursing was sort of like a degree route, they had like enrolled nurses and something else, and I think it's sort of a similar thing to that, but they've changed the sort of terminology around it. So it's 2 years at uni, and you learn a lot of the core skills as you would do on your nursing undergraduate, and then I think after you've done your 2 years, you've got the opportunity to do like an extra year or so to then again change that into a full degree and become a qualified nurse. And I think the trainee nursing associates are now going to be regulated by the NMC as well, which is really another positive move forward. So again, another stepping stone. If you're thinking about nursing but you're not too sure and you've got an opportunity to go into a trainee nursing associate post, you could go to that route, and if you enjoy it, then you can do that extra year or 2 years and then top that up to a full undergrad and then be a qualified nurse at the end of it. So yeah, another good opportunity.
Yeah, brilliant. Thank you. It's such a great role. And as you say, so it kind of sits between healthcare support worker and fully registered nurse. And as Ty said, is a great role in its own right for people, but also a great stepping stone if people do want to move on and become a registered nurse. So brilliant. Thank you. OK, we're on to our last question. And Abdul, we're coming to you. So I know you mentioned that you're undecided in terms of kind of future career plans. And obviously that's, you know, totally understandable. You've got a way to go in your training, and even once you've finished your training, it's, you know, there are so many opportunities. Are there any particular areas that are standing out to you at the minute of particular interest, or is it really just all to play for at this point?
I'm currently actually on the community placement, having done forensics, acute. I'm finding community very interesting, but I'm still undecided in the sense that I want to see how CAMS is like, which is like children and adolescents, and so I'm really undecided, if I'm honest. But yeah. I think I will get there at some point, and that's the great thing of doing this course. I mean, it's you get to experience so many different places, and sometimes even if you're decided, you can sort of change your mind at the last minute. You know, see what goes, see what you like, you know, so sort of thing.
Yeah.
Yeah,
absolutely. And that's, as you say, that's the great thing about placements, isn't it? It gives you that taster of a particular setting, and then that kind of can give you a direction, or sometimes there are rotational posts, aren't there? Once you've registered, you know, you can do a kind of rotational post where you still then get the opportunity to move around different areas. And so yeah, plenty of time to find what you like and where your passion lies. So brilliant. Thank you all so much for joining us this evening. I know that, you know, everything you've all said will, you know, people will have been listening and taking so much from it and kind of recognizing different thoughts and feelings, and you've been helping people to make decisions about where they go from here. So thank you all so much for your time, all 5 of you. So we're going to draw this to a close. We hope that you've enjoyed this session, everybody. We do have, when we post post this video, what we'll do is make sure there are some links that go alongside it, because we do have an NHS Health Careers Contact Centre. So if you've got more questions after this this recording, then please do get in touch with our contact centre. That's open Monday to Friday in office hours, and you can contact them through our website, the Health Careers website, or by phone or by email or through social media. So lots and lots of different ways of getting in touch. And we've got loads of information on the Health Careers website as well, around nursing and different ways to get in. So do go and have a look. But thank you all very, very much for joining us, and have a lovely rest of the evening.